Okay, hey everybody. So I am going to show you how to access your major care plan and what our expectations are for your foundation's major care plan. So you can find it under Canvas under the clinical paperwork section. It's labeled as major clinical document. You will just turn in one of these for this rotation. And when you open up the document, it is a total of 9 pages long. So I'll be sending you a picture of just a short page by page expectation list, just kind of as a cheat sheet, but I figured that this would also be beneficial to those of you who wanted a little bit of extra guidance. So page 1 is just your cover page. You don't need to worry about that. As you move to page 2, you find the Foundation's clinical data collection. So under this, it is just a ton of demographic information, everything from your client's age, the admission date, the reason for admission, all the way down to the trending of their vital signs. So on this page, I know that in the past you guys have had some difficulty obtaining information from the chart just due to time considerations since you don't have access to the charts yourself. I really do want all of the information on this page in particular filled out because this is your client's story. So if for some reason that information is not in the chart, you are more than welcome to ask your patient specifically about their family medical history. The nurses and other staff members should have an idea about the diagnostic procedures. The nursing assistant or whoever is assisting with vital signs, if you are not doing that yourself, should be able to give you a list of those. And one notation that I did want to make here in this box, it wants you to trend your vital signs. So I know we've talked a little bit about why we avoid the use of normal or within defined limits in our clinical paperwork. But for this box in particular, I want you to identify even the slight changes between the fluctuations in blood pressure or O2 sat, things like that, because those even minute changes can add up over time, and we've talked about that a little bit. So page 2 should be pretty self-explanatory. If you have any questions on that, let me know. So we move on to page 3. This is our adult nursing assessment. This is essentially just your head to toe, everything that you have learned in health assessment this semester. So it goes by body system. You can see neurosensory, skin, respiratory, so on and so forth. On this page in particular, you should be able to obtain all of the information because you are performing a head to toe assessment on your patient. I do not want any blanks on this page either. So if for some reason you're unable to assess something or it is not applicable to your patient, you do need to identify that. So for example, right here you see tubes and drains. If your patient doesn't have any, put NA. We don't want to leave anything blank. That's one consideration when documenting on a paper chart. So moving on to page 4, this is your medications list. It has the drug name, which includes both the generic and the trade name, so you should have 2 apiece. The reason the drug was prescribed for your patient. When you look up these medications in your drug book, you will see a whole slew of different reasons that medication may be prescribed. I really want you to try and relate it back to why it was prescribed for your patient. You'll talk about the therapeutic effects that were expected, any adverse effects to monitor for, and what results the patient experienced. So this is where you really need to use your subjective and objective data. So for example, if you decide to use morphine and for your patient's pain rating of 7 out of 10, this is where you would put patient stated that pain went from a 7 out of 10 to a 3 out of 10 30 minutes later. Or if you gave a blood pressure medication, what their blood pressure was at the following vital signs check. So if that doesn't make sense, let me know. Otherwise, I want you to use medications that you gave on your shift. Let's go ahead and do a minimum of 3 on here. When you cite this information, by the way, use the drug book. Moving on, page 5 is your labs and diagnostics page. It does a pretty good job of breaking down every lab that is just basic routine lab work for your hospitalized patient, your complete blood count, your chemistry panels, your analysis. There is some space down here below for specific labs for your patient, but make sure that you get as many of these as possible. Every patient who is hospitalized should have a reading. On here, the different boxes say, why was this test ordered? Tell me briefly for your patient. The test results, where you'll identify if they were normal or abnormal, and what we were doing about it. So for example, if your patient had a sodium level that was far too high and they were dehydrated, we could talk about how we were giving them IV fluids in this section. Your trending of results over time, just a quick notation of what the previous reading was and if that's been pretty consistent for the patient. I do ask that you include the most recent lab work and identify when that was. So for example, if you are including this morning's lab work, you could say drawn at 11/5 at 0500. Down here at the bottom, there are some questions about patient teaching, complications, trends. So you should have something ideally in each of these boxes. For example, maybe you are doing a blood transfusion on your shift because your patient's H&H came back low. This is where you would identify that and the education needed as well. Moving on, page 6 gets a little bit confusing, which is the main reason that I wanted to do this video. This will be your concept map, which I know looks a little scary, but it is essentially the exact same paperwork that you've been doing all semester in a completely different format. It's just changed for this large care plan. So you'll start here in the middle with your medical diagnosis. This is not going to be your nursing diagnosis. So this is where you would, for example, put pneumonia if that is your patient's diagnosis. From there, you will go on and talk about the secondary medical diagnoses. So for example, this might be hypertension or anxiety, things that can maybe contribute to this primary medical diagnosis, but are not the main reason that they are hospitalized. From there, there are boxes with the patient's history, any contributing factors. But from there, you'll hop on over to box 3, your priority problems / nursing diagnosis. I cannot stress this enough. You absolutely have to use your ACLI book for this. I don't want any other nurse labs, care plan interventions. You absolutely have to use that book. So this is going to be your 3-part nursing diagnosis, blank related to blank as evidenced by blank. I'll send you the picture of the board where I took some of those notes down, but it's in 3 parts. You'll have a measurable outcome with your SMART outcomes, and then your nursing actions and interventions with rationales, okay? So you can just have one goal. I want at least 3 interventions. This is the exact same thing that we do on page 2 of your primary clinical paperwork. It should not be new. From there, you'll head over to box 4. This is your physiology and pathophysiology box. You are seriously, guys, just going to define whatever you put in box 2, your medical diagnosis. I want you to tell me what pneumonia is. This is where you cite directly from your textbook or another scholarly source. Once again, I'm okay with things like PubMed, Mayo Clinic, things of that nature. I don't want any random nurse.org sites. From there, box 5 is medications for this condition. These will be the medications that you are specifically administering or that are ordered, even if they're ordered on night shift, for the patient with this medical diagnosis. So specifically for the pneumonia, what medications are we giving? Maybe some antibiotics or some steroids. This might get a little confusing because you have medications for the secondary medical diagnoses. So if we keep with our example of hypertension for one of them, you might write down some of your blood pressure medications here. If we put anxiety over here, we could say maybe what PRN anxiety medications they're on over here. It really just depends on what's going on with your patient. So that might take a little bit of digging, but you do need to complete that after you do the pathophysiology box, because this is really where things are going to start making sense. You connect the dots and understand why some of these medications might be ordered for this diagnosis. From there, everything else is pretty simple. I didn't even write it down on the board. Box 6 is your recent lab and diagnostic data. Box 7, there's not a box 7. There's box 8 with your psychosocial and discharge needs. So this might include the need for discharge education or placement if the patient needs to go to a skilled nursing facility or a nursing home, home health, any of those considerations. Box 9 includes some client teaching. This could be either discharge teaching or the teaching for the day. And then your references. So your ACLI book will be number 1, and then whatever you use for your diagnosis and any other interventions or medications, your drug book, for example. So just keep that in mind as you go through this. Most of this work will already be done on the previous pages. Like I said, the labs and diagnostics, the medications list, it's just plugging it into this concept map where everything starts to tie together, and we have all these arrows that tell you how everything's related. The only box we didn't go over on this says explanation of connection. This just discusses how your secondary medical diagnoses relate to your primary medical diagnosis. So like I said, your patient with pneumonia, perhaps their secondary medical diagnosis of anxiety exacerbates their work of breathing because they're anxious. So that would be a connection that we would include in this box. Okay, moving on, we're almost done. This is page 7, predicting and managing potential complications. All of the boxes on this sheet need to be included. So box 1 over here on the left-hand side would be a potential complication. What are you on alert for today and why? What complication could occur and why? So this is also going to need to be completed after you complete your pathophysiology and look through your nursing interventions, because it will really start to connect the dots as you learn the pathophys behind whatever your patient's primary diagnosis is. From there, each complication will have one intervention. What intervention will prevent the potential complication from occurring, and how will it prevent the complication? So this is where we need to get a little bit more specific. From here, you move on to managing complications. What will you do should the complication occur? How will your planned intervention immediately treat, stop, or reverse the complication? So you'll have potential complication 1, the intervention, and managing the complication. And you'll do that for a total of 4 times. From here, on page 8, this is just your S-bar. You guys have had some practice doing your S-bar at this point. So you'll start with your situation, talk about your patient's demographic information, get into their background, your current assessment, and your recommendation. Most of the time, your S-bar will be if your patient needs a different medication or a lab result reported, or there's been a change in assessment. So make sure that you discuss that. Perhaps your patient states that their pain medication regimen hasn't been quite controlling their pain. This is where you could practice that. So you'll document down here how you would document that after the provider's call. But for the most part, you should cover most of that right here. Okay. And finally, this will probably be the easiest part of your care plan, reflecting and evaluating on your care delivery. This is essentially just a journaling assignment. So you will identify 2 things that you learned during your clinical experience this week. I'm okay with you talking about for this rotation, since you only have this one large care plan and we've been here together for 5 weeks. Go ahead and tell me about it. From there, I want you to answer each of the questions below with approximately 2 to 3 sentences. I don't need a paragraph for each, but I want more than just a few words. And that should be it. If you all have any questions, you know to text or call me anytime, but Make sure that you submit to the drop box, and if you make less than an 80%, you will have the opportunity to earn those points back.